Hello, I'm Dr. Stephen Blomerth. Welcome to Natural Health Today. This is a show dedicated to things that you would like to know about natural health. And we do that by inviting you to participate in our show. And there's 3 different ways you can participate in the show. One way is to send your questions via email to pbdchiropractic@gmail.com. Or you can telephone my office at 978-535-6155. Or you can even write an old-fashioned handwritten snail mail letter to my office address, which is 215 Newbury Street, Suite 102, PBD, Massachusetts, 01960. But whichever way you decide to participate in the show, what we'll do is we'll talk about natural health means of helping you get over whatever your problem may be. Because I've had 37 years of practice experience, and I found that 80 to 90% of the day-to-day problems, pains, aches, and issues that people have don't require drugs and don't require surgery, but that can be helped by means of natural health. And when I say natural health, I think of 4 basic avenues included in natural health. One is manipulation. Manipulation of joints that are stuck can have far-reaching effects, not only in the local area where you might have a stuck joint in your knee or your wrist or your foot or your neck, your back, but also like people may have pain down into their hand. That may be coming from a nerve in the neck. If people don't feel so much in the neck, only in the hand, they think the problem is just in the hand. But when you remove the problem in the neck, the hand pain goes away too. So that's an example of how manipulation can help locally if you have a neck pain, and far away from that site if you, say, have pain down into your hand. Another means of help is via muscle therapy, and I'm not talking about massage so much. I'm talking about trigger point therapy, where trigger points also have quite an effect on people. There are trigger points in the back of your hip and buttock that can give you pain down into your foot. Again, a situation where you think a nerve might be involved, but many times it's just a trigger point in an area that needs to be found, it needs to be worked out, and that can restore you to health. Because trigger points can have devastating effects on how we move, the amount of pain that we feel. The third avenue of natural health that I consider very important is exercise. And I'm not talking about exercises like you get at the gym, because most people who come to me may have been working out exercises they got at the gym or exercises they got through physical therapy. I'm talking about exercises that will help restore your stabilization muscles. Most people have heard the term core strengthening, and they think of core strengthening as strengthening your abdominal muscles, like doing sit-ups or doing crunches. But actually doing sit-ups and doing crunches, for most part, is counterproductive, and if anything, may give you a bad back or a bad neck. So when I talk about stabilization exercises, I talk just about exclusively about a type of exercises called foundation training. And foundation training involves no weights. Most of the exercises are done standing, because that's what we want to strengthen. We want to strengthen the muscles that help us stand and have good posture, because when you stand and have good posture and you're stable, you're less likely to have a pain in virtually every area of your body. So I give exercises to help people's shoulders, knees, and backs, and they all have certain things in common. They're all foundation training exercises. And the fourth avenue of natural health care that I like to talk about is nutrition. And nutrition is probably the largest single thing that you can do over a prolonged period of time to promote your health. It's not necessarily about the vitamins that you take or the herbs that you may use. It's really a question of knowing what to eat, and sometimes when to eat and when not to eat. And you can't make up for a bad diet by taking supplements. Many people say, well, I'd like to lose weight. What kind of vitamins do I need? Well, You don't need to take vitamins to lose weight. They can be important for people from time to time, but good eating, and it's not necessarily overeating, it's people eating the wrong things. And I'd say the biggest thing that I could name off the top of my head is just carbohydrate use. What are carbohydrates? Well, they're everywhere. Bread, pasta, fruit juices. The list goes on, but if people took and ate much less of them, it would be much less, not only overweight, but diabetes and arthritis, heart disease in the world. So that's something you can do for yourself. When we talk about natural health care and we talk about people getting better, we talk about basically those 4 avenues. And if you send in your question, we will slightly disguise your name so your friends and neighbors won't know exactly the nature of the healthcare problem that you're talking about. And we'll talk about natural health means to help you. And if you can't be helped by natural health, we'll tell you that too. But most things, most day-to-day things that people have can be helped very nicely without drugs or surgery. So what I'm going to do, put on my reading glasses, take out some of the questions that have come in since our last episode, and let's see what people would like to know about. Okay. Denise writes in from West Peabody. She says, last week I stepped on a stuffed toy while carrying my 2-year-old son. I landed pretty hard on my butt, and now my back is killing me. He twisted pretty good too during the fall, but I kept him from hitting the ground. Now he's running around kind of funny, but he doesn't act like he's in pain. I don't know what to do because I don't want to take any pain pills right now because I'm pregnant. Okay, so Denise apparently had a fall while she was carrying her son, and she notes that she has pain, and she notes that his gait is off a little bit. Let's talk about kids when they have a problem. Kids don't always show that they have pain. Kids don't necessarily have pain from that kind of a jostling. I've seen young children perhaps not eat. You know, they're not necessarily complaining of being nauseous or sick, but they'll just won't eat as much, or they take some coaxing to eat. And also kids who have a little bit of a jostling to their spine and their pelvis, they will perhaps run a little bit funny. And so what I have seen is that children respond very, very quickly to manipulative care. Now, people say, well, a child having chiropractic care? Yes, children need chiropractic care just as much as they need any other form of care. Do you treat a child in the exact same way as you do an adult? No, because children are quite more flexible. If they have something that doesn't move right, you can use very, very gentle pressures that won't harm them, but that will restore motion to their joints. That's the problem that most people have. It's not so much that a joint has been popped out of place. People use that term a lot. They say, "Doc, did my bone go out of place?" Well, that isn't usually the case. Usually when things get jostled, they just don't move properly. It's not like you have a dislocation. Dislocation is very traumatic, and many times that's beyond the scope of what we do. We don't deal so much with dislocations. We deal with joints that are stuck in a subtle fashion that just require a little bit of movement in the proper direction to enable them to regain the normal motion. Once you regain that normal motion, that child will probably be able to run in a normal fashion. Now, Denise also mentioned that her back is quote-unquote killing her, but she's a little bit hesitant to take any medications because she's pregnant, and that makes perfect sense. Certain times in the pregnancy are not good to take much of any medication, let alone pain pills. So can a chiropractor treat a woman who's pregnant? Not only can they should, because when a woman is pregnant, many things happen to her body, but among these easiest to understand is there is an increased weight in the abdomen. So when the woman moves around, she can't move in a normal fashion. She's bearing a little bit extra weight. And it's easy for women to have back pain when they're pregnant, even if they don't fall. So in Denise's case, where she fell, she came down hard on her butt after tripping on the stuffed toy. She can and should have chiropractic care because that can gently restore the normal motion. Once you restore the normal motion, the pain goes away without drugs, without surgery, and it can be good for her child as well. Yes, young people, 2 years old or younger, can have chiropractic care, and a pregnant woman can have care, and probably should, because it's safer for both of them than any type of drug. Denise, thanks for that question. Okay, Alex writes in from Danvers. He says, I went fishing with my dad at the end of last summer, and we sat in his boat for 5 hours. On the ride home, the middle of my back hurt with a burning pain. When I told my dad, he said he had noticed how much I slouched and that he had had back pain, and for that matter, flat feet too. Do these things run in families? You know, I get that question asked a lot. You know, my dad had back pain, my dad had flat feet. Did I inherit it from my dad? Well, I hate to put the blame on dad or mom. And I haven't actually seen enough studies to say that these sorts of things run in families. But posture, bad posture, prolonged sitting, and as Alex said, his dad mentioned that he had flat feet. All these things will conspire to give you pain sooner or later. How soon? Some people get away with it for years, not having a problem. I've had people come in with bad posture and flat feet, and I've talked to them about it, and they said, well, how come I'm 60 years old and it hasn't bothered me till now? I'll say, you know, you got away with it for 60 years, and that's great. But sometimes you just can't continue to get away with something before having pain. In Alex's case, he seemed to have had his pain brought out by prolonged sitting in a boat. I think 5 hours of sitting in a fishing boat would make me feel bad too. So does pain run in families? It might. Do flat feet run in families? It might. Does poor posture run in families? It might. But the crucial question isn't whether it runs in the family, it's what are you going to do about it. If you do whatever your dad did and do nothing about it, you will probably continue to have pain. If you take some time to have some care, perhaps have your back looked at, have your feet looked at, because you might have inherited your dad's tendency towards flat foot. It's not the end of the world. You just have some orthotics made from impression of your feet. You put them in your shoes, and it's very helpful to a lot of people. Alex, thanks for that question. Back pain, flat feet, bad posture, they don't all run in the family. But if you have them, getting them addressed to minimize your pain and maximize your function is certainly the smartest thing you could do. Alex, thanks for that question. Okay, Amy writes in from Middleton. She says, I had to start taking metformin last week for my diabetes. Just a note to the reader, metformin is a drug that is to help diabetics lower their blood sugar. It's not quite the same as insulin. It's a non-insulin blood sugar lowering drug. I had to start taking metformin last month for my diabetes. I don't know if it's a coincidence, but now I have so many achy muscles and I don't remember doing anything different. I told my medical doctor about the aches, so he wrote me out a new prescription for muscle relaxers, but I just feel tired after I take them. Okay, so Amy, she's diabetic. She's taking metformin to lower her blood sugar, and she noticed that she is now having aches and pains in her muscles, and she told her medical doctor about it, so he wrote her out a prescription for some type of muscle relaxant. Seems to solve the situation, but I think taking 2 drugs when you don't have to take any is probably going to do more harm than good in the long run. Does everybody need to take metformin who is diabetic? No. What metformin does is it's a permission slip for you to go on eating in an improper fashion. I have many patients in my office who are overweight, who don't have the capacity to stop eating in a bad fashion. When I talk to them about what they need to do to either lose weight or control their diabetes, well, I can't eat like that. No, I could never stand that. I'd rather be dead than have to change my diet. Well, the thing is, in the long run, you may be dead, or you may be quite ill. Diabetes, except for people who are born with it, is something that you acquire. Yes, some people are born with diabetes, and that's called type 1 diabetes, but that is not the most common type of diabetes. Type 1 is the least common. The most common is something called adult onset. Now, strange enough, children these days can get adult onset diabetes. What that means is it's not something that you're born with. Type 1 diabetes is due to the fact that your pancreas doesn't put out insulin to help lower your blood sugar. Type 2 is you've eaten incorrectly for so long that you've worn out your pancreas so it won't produce insulin to help lower your blood sugar level. How do you lower your blood sugar level? Well, the best way is by eating the right foods. What are the right foods? Let me tell you what are the wrong foods. Bread, fruit juices, any terribly sweet fruit that you can think of, pineapple, any of the melons, even tomato, particularly tomato juice, all can raise your blood sugar level too high too quickly. That would also apply to pasta, even to things that people think of as healthy, like brown rice. Just about every grain you can think of raises your blood sugar level too quickly. How do you combat it? Well, you've probably heard that term, keto diet. You don't have to go on a keto diet. All you have to do is decrease the amount of starches that you eat, the amount of carbohydrates. What should you eat? Well, your diet should probably mainly consist of fats with some proteins. And people say, well, I don't want any fats, I just want proteins. Proteins are quite hard on your kidneys, so eating too much protein is not doing yourself any good. Do you need proteins in your diet? Yes, most people need proteins in their diet, but you don't want to eat too many proteins. At the top list should be fats, then should be proteins, and at the bottom should be carbohydrates. There are some good carbohydrates that you can eat. Lentils, peas, beans, chickpeas, all of those are forms of carbohydrates that raise your blood sugar level slowly. Anything that raises your blood sugar level quickly is not so good for you. It'll help you gain weight, and it'll tend to push you towards diabetes. Things that raise your blood sugar level slowly don't put the strain on you. So what's the situation about metformin? Metformin is sort of a permission slip that allows you to continue to eat in a poor fashion, but lower your blood sugar level via a drug. However, the downside with some people is it causes muscle pain. So Amy's doctor put her on metformin and gave her permission slip to not change how she eats. It gave her muscle pain, and now he's giving her some type of a painkiller, or as she says, a muscle relaxant, to help make her pain go away. She wouldn't have the pain if she wasn't taking the metformin, and she wouldn't need the metformin if she wasn't eating in a poor fashion. So Amy, you can solve the problem yourself. taking 2 drugs and when you don't need to take one is not a good idea. But thanks a lot for that question. Let's go on to our next question. Okay, Charlie writes in from Beverly. He says, I play tennis 3 days a week, and one of the guys I play with has been complaining of knee and leg pains after playing for a couple of years. Now he says that his pain is gone since his chiropractor made him some foot inserts. How does that help? I can see it helping sore feet, but how can that help your knees? Well, your knees are influenced by many different things, but probably the biggest influence on your knee is your feet, because your feet are your foundation. And if you have an overly high arch or a low arch, in other words, if you have a flat foot, or the opposite of a flat foot is something you haven't heard too much of before. It's called pes cavus. But most people have heard the term flat foot. Most people do have some degree of flat foot, and it's just a fancy word saying extra pronation. Pronation is just when your feet roll in, and the opposite, pes cavus, is like when you stand on the outside edge of your feet. What it does, it changes how your foot works, but it also has an effect further up the chain, because the foot is the basis of our foundation, and the next stop up from our foundation is our knee, then our hip, then our pelvis, then our sacroiliac joint, and our spinal joints all the way up to our head. So if you have a problem with your feet and you're playing tennis 3 days a week, it just makes sense that it might hurt your feet, but if your feet don't hurt, yes, it might hurt your knees. And I definitely have had patients who've had knee pain from running, tennis, other activities. And once you make them a pair of custom-made orthotics made from an impression of their feet, and orthotics is just a fancy word for an insole. Getting an insole made by Dr. Scholl's off your pharmacy counter can work for some people, as long as the insole is an exact replica of your foot and what your foot needs for support. If it helps a little bit though, and not a lot, it's an indication that the store-bought orthotic is evidence that a real good orthotic made from an impression of your foot will help even more. So Charlie, you're right. If a person has foot pain, yes, having some support, custom-made support in your foot is a good idea. But if you also have knee pain or hip pain or back pain, you can't diagnose your own flat-footedness, because when we look down at our own feet, we always stand on the outside edge, and it makes us appear to not have a flat foot. If you sit in a chair, take off your shoes and socks, put one knee up on the other like this, and have a look at the bottom of your foot, you're going to see a perfect arch, even if you're very flat-footed. Because when you're not weight-bearing, when you're not standing on your feet, you're going to have a great arch. The only way to tell is to have both shoes off, both socks off, pants rolled up, halfway up the calf, and just stand there looking forward. Unfortunately, you can't see your foot that way, but somebody who's trained in it can have a look at your foot and look for a few other things that may affect your knee. So Charlie, I hope that helps. Something that goes inside your shoe is a very conservative means of helping you. It won't make you any worse, and for many people it can be the answer to what they need for foot, knee and hip pain. But thanks for that question, Charlie. That was good. Let's go on to our next question. Okay, the next question comes from Anne. She writes in, she says, I get a lot of colds in the winter, and my girlfriend is always telling me to try some herbs so I don't get so many. But are all those things just in her head? Well, yes and no. It depends on the herbs. What can you do to make yourself less likely to have a cold in the winter? Well, probably to get enough sleep, enough rest. That's the big thing. You eat the right foods. Get adequate exercise. Being quiet, not doing anything is not the best idea, because our body's immune system is stimulated by exercise. Our body's immune system also has a lot to do with what we eat and how we treat our tummy and our intestines by the foods that we take in. Do herbs help? Yes, they can be a good adjunct. I would say they're probably better long-term than to wait to do something when you come down with a cold. So what herbs do I recommend? Well, I recommend certainly echinacea. Echinacea is a good herbal tonic for long-term immune system strengthening. But here's the problem. If you get your echinacea down at the local pharmacy, you're not going to get a good form of echinacea. What do I mean by a good form? Something that has a lot of the active ingredients in there. How do you know whether there's active ingredients in there? Well, you can look at the label all day, and the labels, particularly for the herbs that you might get in a CVS or a pharmacy, can be quite deceiving. So here's my way of telling. Open the jar, take a pill, crunch it up in your mouth, and taste it. Within 30 seconds, you should start to feel sort of a metallic tingling. If you don't have a tingle on your tongue, you don't have echinacea there, because real echinacea root, when you chew it up and hold it on your tongue for 30 seconds to a minute, you will feel quite a metallic tingling in there. It's not terrible, but it's strong and it's noticeable. That's when you know you have the good echinacea. Who makes the good echinacea? The only company that I use is a company from Australia called MediHerb. It's spelled MEDIHERB, MediHerb. Their echinacea is the real deal. Just open a bottle, chew on it, and you will see, okay, there's really echinacea in there. But other things can help when you have a cold too. Turmeric can be good, the omega-3s. Vitamin D. Vitamin D is a great thing to take probably all year round as a something to help your immune system. Vitamin D also helps you absorb calcium. It's good for strong bones, and it's also good for retaining muscle mass. And right now, unfortunately, we've come down to the end of our show time. So I'd just like to say thank you for watching Natural Health Today. I'm Dr. Steve Blomerth, and I'd like to invite you to participate in our show like our other guests did today by writing in their questions. Send them to pbdchiropractic@gmail.com or telephone my office at 978-535-6155, or you can write an old-fashioned handwritten letter to my office address, which is 215 Newbury Street, Suite 102, Peabody, Massachusetts 01960. Whichever way you decide to participate, we'll change your name a little bit to disguise it from your friends and relatives who might be watching. And we'll talk about natural health means for you to get a little bit better without drugs, without surgery. Thanks a lot for watching. I'll see you next time. Bye-bye.